All right, so I was dispatched to the home of a 28-year-old female who reported in that she was having chest pain and difficulty breathing. I have arrived and determined that the scene is safe. I am wearing my BSI, my body substance isolation gear. I have my masks on. I have my mask on. I have my gloves on, and I'm approaching with caution. I arrive on scene to find that there is, in fact, one patient. And now I've entered the home and I'm introducing myself. Hello, ma'am. My name is Scott. I'm here with Westchester Community College EMS. I'm here to help. And can I just ask you, what was the reason that you called us in today?
I was having some chest pain and difficulty breathing.
All right. So now that I've determined that the patient has chest pain and difficulty breathing, what I'm going to go ahead and do is just start asking her a few questions to kind of get a sense of where she is. So, ma'am, what is your name?
My name is Anne.
Anne? Okay, nice to meet you, Anne. Do you know where you are right now?
Yes, I'm in Westchester. My home.
More specifically, we're in your home. Okay. Do you know what day it is?
Yes, it's Sunday.
All right, and could you tell me what happened, just prior to you calling 911?
I was cooking, and while I was cooking, I felt pain in my chest, and it was hard to breathe. So I had to stop what I was doing and sit down.
Okay.
So I decided to call you guys.
All right. Well, so you had some chest pain and difficulty breathing, so you had to stop cooking. You decided to sit down. All right. So now this patient is speaking with me, so I would rate her alert on the AVPU scale. So now what I'm going to go ahead and do is move into my ABCs. And first I'm going to check her airway. Ma'am, could you open your mouth for me and say "ah," please? All right, that's plenty fine. Thank you, ma'am. So she is talking to me. I don't see anything in her airway at all. Nothing's immediately blocking it, so we don't need to suction anything. Her airway is open and self-maintained at this time right now. So now I'm going to move on to checking her breathing, following the iPass gas mnemonic device. So what I'm going to go ahead and do is just inspect first. So ma'am, would you mind if I put my hand on you?
Yes, you may.
Okay. And could you just breathe normally for me, please? Okay, so immediately what I'm seeing is the use of accessory chest muscles and muscles in the surrounding anatomy to help her breathe. So I can physically see that she is not meeting adequate tidal volume and that she is struggling to breathe. Now, what I'm going to go ahead and do is just palpate. So do you mind if I, again, touch you?
You may.
All right. And can you breathe for me, please? Okay, again, realizing that there's not adequate tidal volume and she's not getting full breaths in. So now I'm going to go ahead and just auscultate her lung sounds here. All right, ma'am, I'm going to listen to the top of your chest, also known as the apices. All right, I'm just going to go back here. Deep breaths, please. Thank you. Okay, so what I hear is a clear chest bilaterally, so I'm not hearing any obstructions within the chest itself. So now moving on to the seal and stabilize. Ma'am, is there any bleeding? Do you have any open wounds in your chest or anything at all?
No.
No? Okay. So there's nothing to do as far as sealing and stabilizing of her breathing. However, what I am going to do is apply supplementary oxygen. This patient is experiencing chest pain as well as difficulty breathing. So what we're going to go ahead and do is offer her a non-rebreather mask with supplemental oxygen flowing at a rate of 15 liters per minute. So,
Thank you.
all right, ma'am, this is going to be a little bit uncomfortable, but it's going to help you to breathe and should help to open things up and make you feel a little bit better.
Oh wow, it does help.
Okay, all right, well that's great. I'm glad to hear that that's helping. However, we do still want to, just do a little bit further of an inspection to make sure that everything's okay. Now, kind of in that same vein, what I'm going to go ahead and recommend is that we do transport you to the hospital because what you're experiencing could be indicative of potentially something else, and I just don't have the tools in the field here to diagnose that, so I'm not going to go ahead and do that right now.
Okay.
However, to myself, what I'm thinking is that her symptoms are indicative potentially of a myocardial infarction or a heart attack, and that I would rate this patient as being a priority patient because she is having that difficulty breathing. So now what we're going to do is actually just ask her a couple other quick questions following the OPQRST. So ma'am, what was the onset of this? What were you doing that led to this?
Before cooking, well, I had a dance workout.
Okay, so you were participating in strenuous activity prior to cooking immediately?
Mm-hmm. I was doing one of those 80s aerobic exercises.
All right. And then you decided to cook yourself a meal and you started to feel weak as a result of the chest pain and inability to breathe?
Yep.
Okay. And so as far as the provocation, does anything make it better or worse?
Not to my knowledge. The oxygen helped slightly.
Okay, so the supplemental oxygen helped you a little bit. Okay. Now, what about the quality? So what does it feel like, the pain in your chest?
It's painful. It's radiating pain.
Well, as far as the quality goes, is it stabbing? Is it blunt? What does it feel like?
Feels like a stabbing pain.
It's a stabbing pain? Okay. Now, does it, you mentioned radiating pain, so does it radiate anywhere in particular? I noticed you touched your left arm there.
Yeah, it's radiating from my left arm up to my chin.
Okay, so you're feeling the pain move from your chest to your left arm as well as your jaw?
Yes.
Okay. Now, do you recall at all what the severity of this pain might have been when you first felt it on a scale of 10?
Probably an 8 or a 9.
An 8 or a 9. Okay. And when did this pain start?
About 15 minutes before.
About 15 minutes before you called?
15 minutes ago. So
15 minutes ago?
Before you arrived, a couple minutes before I called.
Okay. So now what we're going to do is we're not going to waste any time on the secondary assessment in the field. We're going to actually transport this patient. So for the intents and purposes of the activity here, we have loaded her onto the stretcher and into the back of the ambulance, and now we are in the back of the ambulance. And we're going to continue on with the secondary assessment and assessment of her vitals. So now what I want to do is ask you some questions about your medical history following the sample mnemonic. So as far as signs and symptoms, from what we can see here, you are experiencing chest pain with radiating pain that's moving from the chest into the left arm into the jaw, as well as difficulty breathing, and I can visually see that you're having labored breathing as well. But that seemed to come down a little bit once we gave you the supplemental oxygen. Now, have you come into contact with anything that you might be allergic to?
No.
No? Do you have any allergies that you know of?
Nope.
You don't? Okay.
Born lucky.
Alrighty. Do you know if you're allergic to any medications, Advil, nitroglycerin?
None of them.
Morphine, anything?
I'm not allergic to anything.
Okay, alright, no allergies to medications, that's great. Now, speaking of medications, are you on any medications currently?
Only birth control.
Birth control?
I'm
Alright.
a 28-year-old female.
Alright. And Now, have you had any past medical history of anything similar to this that's shown
No.
you chest pain or difficulty breathing?
No, this is the first.
This is the first instance. Okay. And what was your last oral intake? What did you eat or drink anything, and what time?
I had breakfast about 3 to 4 hours ago. You know, pretty simple, just like
Did you drink
bacon, egg, and
anything?
cheese.
Did you drink anything between now and then?
Strawberry Nesquik.
Was that at the same time as the bacon, egg, and cheese about 3
Yeah,
hours ago?
they go well together.
Okay. So about 3 hours ago, this patient had her last oral intake. So that's going to be pertinent information that we're going to want to share with the arriving medical team, just in case there's any sort of surgery that needs to happen as a result of what this patient's experiencing today. And as far as the event leading up, you did mention, but I want to correctly follow up here and make sure that I have this right. You did mention that you were doing a intensive cardio aerobic exercise, and then you were cooking and you experienced chest pain and difficulty breathing. Is that correct?
Yep.
Okay. All right. So that's the sample mnemonic we have her medical history. So now what we're going to go ahead and do is move on to obtaining a baseline vital signs. So first, what I'm going to go ahead and do is just check her blood pressure and get a blood pressure reading. Ma'am, would you mind holding out your right arm for me? Thank you very much.
Yeah. Yes. All right. I do not mind.
Thank you very much, ma'am. So you might feel some tightness here. That's just going to be the blood pressure cuff. And do your best to just relax your arm, okay?
Okay. So what are you doing after this?
Well, ma'am, all I can really focus on right now is taking your vital signs, so just give me 1 second here, please. Thank you very much. All right, so for her initial blood pressure, we're getting a 110/74. So now what I'm going to go ahead and do is check her respirations. So ma'am, do you mind if I put my hand on your chest?
I do not mind.
All right. And can you just go ahead and breathe normally for me for about 30 seconds or so? All right, so her respirations are 22 breaths per minute, so she's slightly elevated over the normal. So now what we're going to go ahead and do is, first we should release the blood pressure cuff. So we're going to go ahead and get that off of her, but now we're going to go ahead and check her radial pulse here. So I have 86 beats per minute, strong and regular on her heart rate. So now what I'm going to go ahead and do is also just assess the affected area so that we're not missing anything. And one thing that we may have forgotten to ask, actually, so we're going to go back and ask it now. Ma'am, did you experience any sort of bleeding at all today, internally or externally?
Any bleeding? No, I have not experienced any form of bleeding today.
Okay, so was there any blood in your stool or vomit?
No, there was no blood in my stool or vomit.
Okay, and what about your urine? Any blood in your urine?
No blood in my urine either.
Okay, all right. And I'm gonna go ahead and just assess her circulation. Her skin is warm, pink, and dry. And as I mentioned before, she had 86 beats per minute on her heart rate, and that was strong and regular. So now, because this is a high priority patient whose condition can change at any moment, what we're gonna go ahead and do is reassess her vital signs every 5 minutes or so. And we're going to radio this one into the hospital and just let them know that we're arriving with a 28-year-old patient who's experiencing difficulty breathing as well as chest pain, and that she rates it an 8 or 9 out of 10. She had eaten 3 hours previous, so her stomach contents should be empty. However, we will let them know that it's been 3 hours since her last oral intake, that she's not allergic to any medications that she's aware of. There's been no past medical history involved with this one that could lead into anything that might show anything. She's not on any medications for this currently, and that she was doing a strenuous exercise prior to feeling this way, and had been experiencing pain for about 15 minutes or so. We did apply the non-rebreather mask with 15 liters per minute of oxygen flow. And that she did indicate that helped to bring the difficulty breathing down just a little bit, and helped her to open up just a bit. So we are transporting her to the hospital today, and we're going to be leaving her in the care of a nurse or nurse practitioner when we get to the hospital, who is going to reassess her from there. However, like I said, we're going to reassess every 5 minutes to check for any changes in her blood pressure, her condition, her heart rate, and as well, just one last thing before we go, we're checking her pupils, and they are equal and reactive to light currently. So that is part of something that we will be reassessing every 5 minutes, because with these types of incidences, you never know, the patient's blood pressure may suddenly drop, and she may go into shock at any moment, so we're going to keep reassessing the patient without indicating to her that might happen.
I heard nothing.